In health emergencies, effective risk communication is crucial for building trust, managing information, and protecting communities. This training will guide you through the essentials of communicating during health crises. Welcome to the course on effective risk communication in health emergencies. You'll learn key principles and strategies, including crisis communication, public health messaging, and managing misinformation. Risk communication is vital because it saves lives, builds public trust, reduces panic, supports emergency response, and encourages protective behaviors. It's more than just sharing information, it's about shaping public behavior and trust. Lessons from past global health emergencies like SARS, Ebola, and COVID-19 show the importance of clear messaging. Each event highlighted different challenges and the need for effective communication strategies. Understanding public risk perception is crucial. Fear, uncertainty, trust, social influence, and cultural factors all shape how information is received during a health emergency. Effective communication is built on accuracy, transparency, timeliness, consistency, and empathy. These principles form the foundation of public confidence during health emergencies. Risk communication involves multiple stakeholders, including public health authorities, government agencies, and media organizations. Each plays a vital role in reaching and protecting communities. Effective communication during health emergencies requires a multi-channel approach, including television, radio, social media, and community outreach. Each channel serves a unique purpose in reaching diverse populations. Trust is the foundation of communication. It involves credibility, transparency, accountability, consistency, and community engagement. Building trust before a crisis is essential for effective communication. Challenges in health emergency communication include misinformation, rumors, public anxiety, political influences, and information overload. Addressing these challenges is crucial for effective communication. The future of emergency communication will be shaped by smart systems, predictive risk messaging, digital engagement, real-time analytics, and AI-powered communication. Combining empathy with technology is key. In this chapter, we delve into the foundational aspects of risk communication during health emergencies. Understanding how accurate, timely, and trustworthy information can save lives, build resilience, and guide communities through uncertain times is crucial. During health emergencies, people need accurate, timely, and trustworthy information to make informed decisions that protect themselves, their families, and their communities. Risk communication is a critical public health function that helps manage uncertainty, reduce fear, encourage protective behaviors, and maintain public trust during emergencies. Risk communication is the real-time exchange of information, advice, and opinions between experts, authorities, organizations, and people facing threats to their health, safety, or well-being. Its purpose is to inform the public, reduce uncertainty, build trust, encourage action, and support emergency response. Risk communication matters because it saves lives, supports public health measures, reduces panic and fear, encourages community cooperation, improves emergency response, and builds long-term trust. Coordinated communication enhances the effectiveness of response operations and strengthens institutional credibility. Risk communication applies across a wide spectrum of public health crises, each presenting unique communication challenges and community needs. From disease outbreaks and pandemics to environmental health emergencies and chemical incidents, effective communication is key to managing these situations. Public health communication has transformed dramatically over decades, driven by technological advances and lessons learned from major health crises. From traditional public information to AI-powered systems, each stage represents a significant shift in how we manage public messaging during emergencies. The primary objectives of risk communication are to inform, educate, reassure, motivate, and build trust. Providing accurate, evidence-based information, increasing public understanding, reducing anxiety, encouraging protective behaviors, and strengthening trust in health authorities are essential components. Trust plays a crucial role in health emergencies. Communities that trust health authorities are more likely to follow guidance and adopt protective measures. Trust supports compliance, reduces misinformation impact, strengthens community resilience, and improves emergency outcomes. How people perceive and respond to risk is shaped by emotion, experience, media, and trust, not just objective data. Emotional reactions often precede rational analysis, fear can influence decisions, personal experiences shape perception, and media influences public understanding. Effective risk communication must account for the complex social, cultural, and economic factors that shape how communities receive and act on health information. Culture, social influence, education, access to information, economic conditions, and trust in institutions all play a role. Effective risk communication is guided by 5 essential principles. Be first, be accurate, be credible, express empathy, and promote action. These principles ensure clarity, trust, and engagement in all messaging. Clear, concise, consistent, action-oriented, evidence-based, and audience-focused messages are more effective than highly technical communications during emergencies. Clarity saves lives. Effective emergency communication requires coordinated action across a diverse ecosystem of organizations, institutions, and community actors. Government agencies, public health authorities, hospitals, media organizations, and the general public all play vital roles. Television, radio, websites, social media, mobile alerts, and community outreach are essential channels for delivering urgent health warnings directly to individuals. Each channel plays a unique role in ensuring timely and effective communication. Rapidly changing information, public anxiety, rumors, misinformation, information overload, limited resources, and cultural barriers are significant challenges in emergency communication. Addressing these challenges is crucial for effective messaging. COVID-19 demonstrated that effective communication can significantly influence public behavior and healthcare outcomes. Transparency, consistent messaging, managing misinformation, building public trust, and global coordination are key lessons learned. Media organizations serve as primary conduits for reaching mass audiences with urgent health updates. They play a vital role in information dissemination, public education, influencing perceptions, amplifying messages, and supporting community awareness. Effective risk communication is not a one-way broadcast. It requires genuine dialogue, active listening, and meaningful community partnership. Listening to community concerns, encouraging feedback, partnering with local leaders, and building community ownership are essential. Several globally recognized frameworks guide how health authorities structure and deliver communication during emergencies. These frameworks emphasize community engagement, trust-building principles, and structured communication approaches. Emerging technologies like AI, predictive messaging, and real-time analytics are transforming risk communication. Future capabilities include personalized health communication, smart community engagement platforms, and digital public health ecosystems. Risk communication is a vital component of public health emergencies. It plays a crucial role in managing uncertainty, reducing fear, encouraging protective behaviors, and strengthening community resilience. The lessons from global health emergencies, including COVID-19, underscore the importance of transparency, consistency, and trust. Explore the structured guide to principles and frameworks that enable effective communication during public health emergencies. During health emergencies, information can influence behavior, public trust, and health outcomes. Effective communication requires established principles and proven frameworks that guide decision-making and messaging. Core insight: risk communication is most effective when it is transparent, timely, accurate, empathetic, and focused on public needs. Risk communication principles are fundamental guidelines that help organizations communicate effectively during emergencies and public health crises. Their purpose is to improve message effectiveness, strengthen public trust, support decision-making, encourage protective actions, and reduce confusion. People seek information immediately during emergencies. If authorities do not provide information quickly, others will fill the information void, often with rumors and misinformation. Early official communication dramatically reduces the spread of rumors and misinformation during emergencies. Accuracy is the cornerstone of public trust. Releasing unverified information, even with good intentions, can cause lasting damage to institutional credibility. Verify information before release, correct mistakes quickly, avoid speculation, and communicate uncertainty honestly. When the public trusts the source of information, they are significantly more likely to follow guidance and adopt protective behaviors. Credibility must be earned and consistently maintained. Use trusted experts, maintain consistency, and provide evidence-based information. People are more likely to trust communicators who acknowledge their concerns. Empathy is not a soft skill. It is a strategic communication tool that builds connection and compliance. Address fear, anxiety, uncertainty, frustration, and grief with compassion in all public messaging. Effective risk communication does not stop at informing, it empowers people to act. Action-oriented messaging reduces helplessness and drives protective behaviors. Provide clear instructions, explain protective measures, empower communities, and reduce helplessness. Transparency strengthens trust even when the available information is incomplete. Being candid about uncertainty or withholding information, even with protective intent, consistently reduces trust and erodes public confidence. Share what is known, explain ongoing investigations, and avoid hidden information. When multiple agencies and organizations communicate during an emergency, inconsistent messages create confusion, erode trust, and undermine public compliance. Coordination is not optional, it is essential. Ensure uniform information across agencies, coordinated communication, and consistent public guidance. Effective risk communication is never one size fits all. Understanding the specific needs, concerns, and characteristics of different audience segments is fundamental to message effectiveness. Consider cultural factors, literacy levels, language preferences, and community concerns. A structured model that guides communication activities before, during, and after emergencies. Frameworks provide organizations with a systematic approach to planning, executing, and evaluating their communication efforts. Benefits include standardized communication, improved coordination, better decision-making, and enhanced effectiveness. The WHO framework emphasizes that risk communication must be a core part of public health communication, comprehensive yet simple, not just responses. It includes community engagement, information sharing, listening to concerns, building trust, and empowering communities. CIRC combines the best practices of crisis communication and risk communication into a single, integrated framework. It is designed to help organizations communicate effectively under the extreme pressure and uncertainty of real emergencies. It combines crisis and risk communication, focuses on timely action, supports public decision-making, and promotes trust and transparency. The CIRC model recognizes that communication needs evolve across the phases of an emergency. Each phase requires a distinct communication strategy and set of priorities: pre-crisis, initial event, maintenance, resolution, and evaluation. Community engagement is not a supplementary activity, it is a core communication strategy. Frameworks that center community participation consistently produce better health outcomes and stronger public trust. Listen before communicating, involve community leaders, encourage participation, build partnerships, and strengthen local trust. Effective risk communication must account for how people actually think and behave. You can help with social influence, address individual decision-making under stress, and change behaviors. Decision-making under stress, risk perception, social influence, and behavioral change strategies are key components. Integrated communication systems significantly improve emergency response coordination and public confidence. Organizations that pre-establish multi-agency communication protocols consistently outperform those that improvise during crises. Understanding what goes wrong is as important as knowing what to do right. These failures consistently appear in post-emergency reviews and have measurable negative impacts on public health outcomes. Each failure type erodes public trust and reduces compliance with protective health guidance. The digital revolution is transforming risk communication. New frameworks are emerging that leverage technology, data, and artificial intelligence to reach the public faster, more accurately, and more effectively than ever before. Successful risk communication depends on precise principles and structured frameworks that guide public messaging and foster trust. Be first, be accurate, be credible, be empathetic, and promote action. The goal of risk communication is to equip people to act in their best interest. Exploring how people interpret threats, make decisions, and respond during health emergencies, and how communicators can use these insights to protect communities. During health emergencies, people's behaviors are influenced not only by scientific facts but also by emotions, beliefs, experiences, and culture. Understanding how people perceive risks helps communicators develop messages that encourage appropriate actions and improve public safety. Risk perception is the way individuals interpret, understand, and emotionally respond to potential threats to their health and safety. It is subjective, socially shaped, emotionally influenced, and dynamic over time. How people perceive a threat directly determines whether they take precautionary steps to protect themselves and others. It influences protective behaviors, affects public compliance, shapes trust in authorities, impacts emergency response outcomes, and determines information-seeking behavior. People often overestimate some risks while underestimating others, creating a gap between scientific reality and public behavior that communicators must bridge. Personal experiences, family and social influence, media coverage, cultural beliefs, education levels, and trust in institutions all shape how individuals perceive and react to risks. Emotions often influence decisions more strongly than statistics during crisis situations. Effective communicators acknowledge feelings before presenting facts. Calibrating the emotional tone of risk messages is one of the most critical skills in emergency communication. Too little urgency breeds complacency, while too much breeds panic. Social cohesion and collective action are amplified when people trust both institutions and each other during crises. The social amplification of risk framework explains why some events with relatively low risk generate enormous public concern, while others with high risk receive little attention. Cultural beliefs and traditions shape how communities interpret illness, suffering, and the appropriate response to health threats. Behavioral responses during emergencies span a wide spectrum, from highly adaptive protective actions to counterproductive panic responses. Understanding this range helps communicators anticipate and address community needs proactively. People often consult multiple information sources simultaneously during emergencies, cross-referencing official guidance with social networks, media, and personal contacts to form their understanding of risk. Fear, anxiety, and information gaps drive the spread of misinformation, which undermines adherence to protective measures and increases public distrust. Effective risk communication must account for the unique needs, vulnerabilities, and communication barriers faced by different population groups. Different audience segments fall on the risk tolerance spectrum, allowing communicators to tailor message intensity, framing, and channel selection for maximum effectiveness. Understanding cognitive biases and decision-making shortcuts helps design messages that work with human psychology rather than against it. Health campaigns using trusted local leaders often achieve significantly higher public participation and compliance rates than those relying solely on official government channels. Continuous monitoring of public perception allows health communicators to identify emerging concerns, correct misinformation rapidly, and adapt messaging in real time to maintain public trust and cooperation. Smart public engagement systems combining AI, behavioral science, and communication expertise allow effective, evidence-based health communication at scale. The bridge between scientific knowledge and public behavior is built through empathy, trust, cultural sensitivity, and evidence-based communication strategy. Explore the essentials of crisis communication planning, a vital guide to safeguarding lives during health emergencies. In times of health emergencies, timely and effective communication is crucial. Organizations must be ready to act immediately, ensuring public safety and trust. Crisis communication planning involves preparing strategies and resources to manage information during emergencies. It's about building a reliable and credible response system. Preparedness reduces response delays, strengthens public confidence, and enhances coordination. It's essential for consistent and effective communication under pressure. A robust communication plan includes objectives, stakeholder identification, and procedures. Each component supports a comprehensive response infrastructure. Identifying potential risks is crucial before developing communication strategies. This assessment helps prioritize actions based on impact and urgency. Understanding who needs information and how to reach them is key to effective crisis communication planning. Clear roles prevent duplication and confusion during emergencies, ensuring alignment with response objectives. Well-defined objectives guide communication efforts, ensuring transparency and consistency during emergencies. Pre-developed messages are vital tools in crisis communication, enabling faster and more effective responses. Tailoring messages to specific audience needs ensures effective communication during emergencies. A multi-channel strategy ensures information reaches diverse audiences quickly and effectively. Proactive media strategies transform reactive scrambling into coordinated press engagement during emergencies. Social media is a powerful tool for communication during emergencies, requiring strategic and defensive use. Investing in spokesperson development enhances public trust and confidence during emergencies. Protocols ensure every team member knows their role, enabling timely and accurate information release. Regular training transforms plans into effective actions during emergencies, building organizational resilience. Drills and exercises reveal what works and what doesn't, preparing teams for real emergencies. Established monitoring systems identify communication gaps, enabling real-time adjustments that save lives. The next decade will transform crisis communication through AI, predictive analytics, and digital simulations. Effective crisis communication planning is an ongoing process, integrating various strategies to ensure readiness and resilience. In this chapter, we delve into the essential strategies for effective communication during disease outbreaks and pandemics. Understanding and planning are key to executing public health communication strategies. Communication is a vital tool in managing the uncertainty and fear that accompany disease outbreaks. By providing clear and accurate information, authorities can guide public behavior, reduce panic, and support disease control measures. Understanding the progression from outbreak to epidemic to pandemic is crucial for tailoring communication strategies. Each stage demands a different approach in reach, coordination, and urgency. Effective communication during outbreaks protects public health, supports disease prevention, and maintains public trust. It encourages healthcare-seeking behavior and supports government response. During disease outbreaks, communication objectives include informing the public, explaining risks, and promoting protective actions. Supporting objectives focus on countering misinformation and encouraging community participation. Outbreak communication is a continuous process that adapts to each stage of the disease event, from detection to evaluation. Each phase requires specific communication strategies to be effective. Communicating scientific uncertainty involves acknowledging what is unknown while providing actionable guidance. This approach helps maintain public confidence even when data is limited or evolving. Building public trust during outbreaks relies on transparency, consistency, honesty, empathy, accountability, and community engagement. These elements ensure effective communication and public cooperation. Communicating protective health measures involves clear guidance on hand hygiene, vaccination, physical distancing, mask usage, isolation, and healthcare-seeking guidance. These measures are crucial in controlling disease spread. Managing public fear and anxiety during outbreaks involves acknowledging concerns, providing reassurance, sharing facts, avoiding alarmist language, and promoting positive action. Empathy and clear communication are key. Effective communication for vaccination campaigns focuses on increasing awareness, addressing concerns, promoting confidence, encouraging participation, and combating misinformation. These efforts are vital for successful vaccination uptake. Managing rumors during outbreaks requires identifying them early, verifying facts, responding quickly, using trusted sources, and monitoring public reactions. Consistent and accurate communication is essential. Misinformation and disinformation during outbreaks pose significant challenges. Addressing false health claims, conspiracy theories, fake treatments, and social media amplification is crucial for public safety. Media relations during disease outbreaks are crucial for bridging the gap between health authorities and the public. Effective media engagement ensures accurate information reaches communities swiftly. Community engagement is vital during outbreak response. Engaging community leaders, religious leaders, local organizations, healthcare workers, and volunteer networks amplifies reach and builds trust. Healthcare worker communication is crucial during outbreaks. Key areas include clinical updates, safety guidance, PPE information, mental health support, and operational changes. These ensure effective outbreak response. Communication during large-scale pandemics requires unprecedented coordination across borders and institutions. A pandemic communication hub facilitates global coordination, public health diplomacy, and multi-agency communication. Lessons from COVID-19 highlight the importance of timely information, managing scientific uncertainty, social media challenges, public trust dynamics, and community engagement successes. These lessons guide future communication strategies. Monitoring communication effectiveness during outbreaks involves public awareness surveys, social media analytics, media monitoring, public sentiment analysis, and behavioral tracking. These measures ensure adaptive communication strategies. Future outbreak communication technologies include AI-powered monitoring, predictive messaging, automated alert systems, personalized health communication, and real-time sentiment analysis. These innovations enhance response capabilities. Effective communication during disease outbreaks and pandemics is essential for building trust, promoting protective behaviors, managing uncertainty, countering misinformation, and supporting public health response efforts. Chapter 6 provides a comprehensive guide to building effective media partnerships, managing public information, and communicating accurately during health emergencies. During health emergencies, the media plays a critical role in disseminating information through various channels. Effective media relations ensure accurate information reaches communities quickly. Strong media partnerships help public health authorities communicate effectively, combat misinformation, and maintain public trust during crises. Media relations involve building and maintaining productive relationships with journalists and media organizations to share accurate public health information. Core objectives include informing the public, building trust, promoting transparency, and reducing misinformation. Media relations are crucial during emergencies for rapid information dissemination, broad public reach, public education, behavior change, rumor reduction, and community reassurance. The media's role in health emergencies includes information sharing, raising public awareness, risk education, accountability support, community engagement, and providing emergency updates. Establishing media contacts, developing journalist networks, conducting media briefings, sharing health information regularly, and building credibility are key strategies for effective communication before emergencies. To build effective partnerships, public health communicators must understand what journalists and media organizations require: timely information, expert sources, visual content, accurate facts, clear explanations, and consistent updates. Public information management involves collecting, verifying, organizing, and distributing accurate information during emergencies to ensure communities receive reliable guidance. This cycle ensures that every piece of information passes through rigorous quality controls before reaching communities. Verification processes include verifying facts, confirming sources, reviewing scientific evidence, checking data accuracy, and obtaining approvals to ensure all public communications are credible and reliable. Effective public health messages during emergencies must be simple, clear, action-oriented, audience-focused, consistent, and evidence-based. Public messages with 3 key points are often remembered better than lengthy explanations. Effective press releases should include a headline, situation summary, key facts, public guidance, expert quotes, and contact information. These components ensure clear and concise communication during emergencies. Organizing press conferences involves defining objectives, selecting spokespersons, preparing key messages, anticipating questions, and providing supporting materials. Preparation is crucial for successful media briefings. Effective media briefings require transparency, calmness, clear communication, avoidance of technical jargon, acknowledgement of uncertainty, and empathy. These elements help maintain credibility and trust. Productive journalist relationships are built on mutual respect, reliability, and professional integrity. Key principles include respecting deadlines, providing accurate information, offering expert access, maintaining professional relationships, and correcting errors promptly. Handling difficult media questions involves staying calm, acknowledging concerns, focusing on facts, avoiding speculation, and bridging back to key messages. This structured response framework helps manage challenging moments with confidence and credibility. Systematic media monitoring enables health authorities to track how their messages are being received, identify emerging misinformation, and adapt communication strategies in real time. Misinformation spreads rapidly during health emergencies. Proactive media partnerships are the most effective defense against false narratives that endanger public health. Strategies include rapid response, fact-checking, corrective messaging, media partnerships, and trusted experts. Visual communication improves public understanding of complex health risks and emergency guidance. Infographics, charts, maps, videos, and public health dashboards are essential tools for effective communication. Challenges include breaking news pressure, incomplete information, conflicting reports, public anxiety, social media amplification, and political influences. Addressing these challenges is crucial for effective communication. The future of media relations in health emergencies involves AI-assisted media monitoring, automated news analysis, real-time fact-checking, digital news ecosystems, predictive communication analytics, and integrated communication platforms. This chapter covered understanding media relations, the role of media during health emergencies, public information management, message development, media briefings, journalist engagement, and media monitoring. These elements are crucial for effective communication during health crises. In today's interconnected world, mastering digital communication is crucial for protecting communities during health emergencies. This chapter explores the role of social media and digital platforms in managing misinformation and ensuring effective communication. Social media can be a powerful tool in health emergencies, helping authorities communicate rapidly and accurately. However, it can also accelerate rumors and misinformation. Effective digital communication requires speed, accuracy, and proactive misinformation management. Digital communication involves using online platforms to share health information, engage communities, and support emergency responses. Key platforms include social media, websites, mobile apps, SMS alerts, email, and digital news. Social media plays a vital role during emergencies by enabling rapid information sharing, reaching wide audiences, providing real-time updates, engaging the public, gathering community feedback, and monitoring crises. Various social media platforms serve different purposes in public health communication. From Facebook's community groups to Twitter's rapid alerts, each platform offers unique benefits for engaging with the public during health emergencies. Social media offers immediate communication, direct public access, interactive engagement, public feedback collection, enhanced awareness, and improved outreach during health emergencies. While social media is beneficial, it also poses risks such as spreading rumors, misinformation, disinformation, fake news, information overload, and public panic. Understanding these risks is crucial for effective management. Distinguishing between misinformation and disinformation is critical for designing effective response strategies. Both can harm public health by causing confusion and driving unsafe behaviors. An infodemic is an excessive amount of information that makes it difficult to find trustworthy guidance during health emergencies. It involves information overload, rapid spread, public confusion, and increased anxiety. Monitoring digital conversations involves social listening, trend analysis, sentiment monitoring, hashtag tracking, and community feedback analysis to understand public discourse during health emergencies. Social listening tools and techniques include keyword monitoring, trend detection, community sentiment analysis, influencer monitoring, and risk identification to manage public health information effectively. Early detection of misinformation significantly improves corrective communication efforts. Monitoring viral content, verifying sources, and analyzing public concerns are crucial steps in this process. Effective misinformation response requires speed and precision. Acting quickly prevents false narratives from taking hold, while evidence-based corrections rebuild public confidence and guide safe behaviors. Fact-checking involves verifying sources, cross-checking information, using scientific evidence, collaborating with experts, and communicating corrections transparently to ensure accuracy and trust. Building trust involves transparency, consistency, empathy, timely updates, interactive engagement, and accountability. These elements are essential for effective digital communication during health emergencies. Engaging communities online involves answering questions, addressing concerns, encouraging feedback, hosting live sessions, and promoting community participation to build authority and confidence. Partnering with healthcare professionals, community leaders, scientists, educators, and social media influencers amplifies accurate health messages and reaches audiences that may not engage with official channels. Crisis communication on social media involves real-time updates, emergency alerts, public safety instructions, rumor management, and community support to ensure effective response during emergencies. Measuring the effectiveness of digital communication involves assessing reach growth, engagement rate, and misinformation reduction to ensure strategies are impactful during emergencies. The future of digital risk communication involves AI-powered monitoring, automated fact-checking, predictive detection, personalized communication, virtual engagement, and intelligent systems to enhance public health support. Social media and digital communication are powerful tools for emergency risk communication. Success depends on timely, engaging, and effective use of these technologies to support public health objectives. Explore how to build resilient communities through collaboration, transparency, and trust during health emergencies. Communities play a crucial role in prevention, preparedness, response, and recovery during health emergencies. Their involvement ensures effective management beyond government capabilities. Community engagement involves collaborative efforts with individuals and organizations to address health and well-being issues. It's about creating a network of shared responsibility. Strong community engagement leads to faster information dissemination and better recovery outcomes, while weak engagement can delay responses and increase misinformation. Public trust is the confidence people have in organizations and leaders. It influences risk perception, information acceptance, and overall emergency response success. Transparency, consistency, empathy, and competence are key factors in building public trust. These elements help reduce speculation and increase confidence. Effective communication involves listening first, understanding needs, respecting perspectives, encouraging participation, and promoting dialogue. Mapping stakeholders by influence and reach helps tailor engagement strategies for maximum impact. Key stakeholders include government agencies, healthcare providers, and community leaders. Community leaders act as trusted messengers, network amplifiers, and cultural bridges, enhancing message acceptance and reach. Building partnerships involves mutual respect, shared goals, ongoing collaboration, capacity building, and long-term relationships. These elements strengthen community ties. Community participation includes risk identification, preparedness planning, resource mapping, volunteer programs, and emergency exercises. These activities enhance readiness. Listening is crucial during emergencies as it reveals hidden fears and informs targeted communication strategies. It builds trust and prevents misinformation. Addressing concerns involves providing clear information, acknowledging emotions, correcting misunderstandings, offering practical solutions, and following up regularly. Active engagement during outbreaks includes risk awareness campaigns, vaccination promotion, rumor management, and support services, leading to better outcomes. During recovery, focus on information sharing, mental health support, community rebuilding, ongoing health monitoring, and capturing lessons learned to strengthen preparedness. Volunteers extend the reach of response teams and include health ambassadors, youth programs, and peer educators, enhancing community communication efforts. Cultural sensitivity is essential for effective communication. Adapting strategies to respect cultural practices and promote inclusion builds trust across diverse populations. Key metrics include trust threshold, response speed, misinformation reduction, and higher participation, indicating the effectiveness of engagement strategies. Challenges include historical mistrust, information overload, language barriers, resource constraints, and the digital divide, affecting engagement effectiveness. Future engagement involves AI feedback systems, digital platforms, predictive models, and integrated volunteer management, enhancing community resilience. Effective community engagement requires active listening, genuine collaboration, transparent communication, and long-term investment in trust and relationships. Ensuring equitable access to health information for every individual is crucial, especially during emergencies and beyond. Health emergencies affect everyone, but vulnerable groups face unique challenges in accessing vital information. Inclusive communication ensures no one is left behind. Vulnerable populations may face increased health risks and barriers to communication, especially during emergencies. Inclusive communication protects high-risk populations, reduces inequalities, and builds trust, ultimately supporting public health goals. Language differences, internet access, and cultural barriers can hinder effective communication during emergencies. Health literacy involves understanding and using health information to make informed decisions, which can be challenging during emergencies. Clear language, slow speech, and written materials are key to effectively communicating with older adults during emergencies. Tailoring communication to children involves using age-appropriate language and encouraging questions to reduce fear and anxiety. Accessible communication for people with disabilities includes sign language, alternative communication methods, and screen reader compatibility. Simple language, visual aids, and trusted local messengers are effective for communicating with low literacy populations. Effective communication with migrants and refugees involves multilingual information, cultural sensitivity, and trusted community networks. Cultural competence in risk communication involves understanding and respecting diverse backgrounds to improve compliance during emergencies. Community leaders, including religious and cultural leaders, play a vital role in effective health communication. A comprehensive language access strategy ensures everyone receives and understands critical health information promptly. Effective communication during public health emergencies involves clear messaging across various crises, from disease outbreaks to natural disasters. Addressing misinformation involves understanding community concerns, using trusted sources, and providing timely corrections. Digital inclusion ensures everyone can access health resources, regardless of their technological capabilities. Community outreach strategies, such as door-to-door campaigns and mobile health units, ensure critical health information reaches isolated populations. Measuring communication effectiveness involves tracking message reach, community participation, and behavioral outcomes. Future trends in inclusive risk communication include AI-powered translation and personalized messaging to enhance accessibility. Effective communication with diverse populations requires accessibility, cultural sensitivity, and continuous improvement to ensure everyone receives critical health information. Explore how effective communication during health emergencies builds trust and supports crisis response through skilled leadership and media engagement. During health emergencies, leaders guide public reassurance and trust. Effective communication can significantly influence public trust and crisis outcomes. Leadership communication connects information to action, building public confidence to navigate crises. It provides direction, builds trust, supports decision-making, coordinates stakeholders, promotes transparency, and inspires confidence. Clear guidance during emergencies influences public behavior, reduces panic, and strengthens cooperation. Effective communication is crucial for community buy-in. Effective leaders possess credibility, transparency, empathy, accountability, decisiveness, and adaptability. These qualities guide communities through uncertainty with authority and compassion. Spokespersons communicate critical information to the public and media, delivering key messages, answering questions, and maintaining credibility. Effective spokespersons have strong communication skills, subject matter knowledge, emotional intelligence, confidence under pressure, active listening, and professionalism. Spokesperson preparation involves media training, scenario practice, interview simulations, and crisis exercises to build competence and confidence before crises strike. Key messages are the foundation of emergency communication, crafted to cut through noise and drive protective action. They include a main message, supporting facts, and a call to action. Effective delivery transforms words into trust. Speak clearly, use plain language, maintain eye contact, show confidence, avoid jargon, and reinforce key points. Empathy is a strategic tool that influences trust and acceptance of public health guidance. It acknowledges concerns, builds trust, demonstrates compassion, supports well-being, and improves message acceptance. Press briefings provide updates and address concerns, maintaining public confidence during emergencies. Scheduling and accessibility are crucial for effective communication. Successful press briefings require clear objectives, prepared key messages, selected speakers, anticipated questions, supporting materials, and tested technical systems. A well-structured press briefing follows a logical flow, ensuring key messages are heard and retained. It begins with an opening statement and ends with a call to action. Spokespersons must remain calm, avoid speculation, acknowledge concerns, answer honestly, bridge back to key messages, and maintain professionalism when handling difficult questions. Communicate uncertainty by explaining what is known and unknown, sharing actions, providing updates, and avoiding false certainty to maintain credibility. Nonverbal communication, including facial expressions, body language, voice tone, appearance, and professional presence, significantly impacts message delivery. Emergency spokespersons face intense scrutiny and must stick to verified facts. Understanding these pressures is key to maintaining effectiveness. Continuous evaluation of communication performance is essential for improving future responses. Key indicators include public trust, media coverage, audience understanding, communication reach, and stakeholder feedback. Emerging technologies are transforming public health communication, offering new opportunities for precision, reach, and impact through AI, analytics, virtual press conferences, and more. Leadership and skilled spokespersons are essential for successful crisis communication. Transparency, empathy, and media engagement build trust and support effective responses. Explore the essential skills for leadership and spokesperson roles during health emergencies, focusing on effective communication and media engagement. In times of crisis, lead as communication shapes public response. Effective communication builds trust and guides behavior, impacting crisis outcomes. Leadership in emergencies is crucial for guiding communities. It involves providing direction, building trust, supporting decisions, coordinating stakeholders, promoting transparency, and inspiring confidence. Effective communication during emergencies influences public behavior, reduces panic, and strengthens cooperation, showcasing the importance of leadership. Effective emergency leaders possess credibility, transparency, empathy, accountability, decisiveness, and adaptability, guiding communities through uncertainty. A spokesperson communicates crucial information to the public and media, ensuring clarity and maintaining credibility while representing the organization. An effective spokesperson has strong communication skills, subject matter knowledge, emotional intelligence, confidence under pressure, active listening, and professionalism. Preparing a spokesperson involves media training, scenario practice, message familiarization, and crisis exercises to build confidence and competence. Key messages in emergencies must be clear, supported by facts, and include a call to action to effectively communicate with the public. Delivering messages effectively requires clarity, plain language, eye contact, confidence, avoiding jargon, and reinforcing key points. Empathy in communication acknowledges public concerns, builds trust, demonstrates compassion, supports emotional well-being, and improves message acceptance. Press briefings during health emergencies provide accurate information, address concerns, maintain transparency, and support public health actions. Planning a press briefing involves defining objectives, preparing key messages, selecting speakers, anticipating questions, preparing materials, and testing systems. An effective press briefing follows a structured format, ensuring information is delivered clearly and key messages are retained. Handling difficult questions requires calmness, avoiding speculation, acknowledging concerns, bridging back to key messages, and maintaining professionalism. Communicating uncertainty involves explaining knowns and unknowns, sharing ongoing actions, providing updates, and avoiding false certainty. Nonverbal communication, including facial expressions, body language, voice tone, appearance, and professional presence, significantly impacts message delivery. Managing communication during high-pressure situations involves handling public attention, emotional audiences, rapidly changing information, and political sensitivity. Evaluating leadership communication performance involves assessing public trust, media coverage, audience understanding, communication reach, and stakeholder feedback. Emerging technologies are transforming leadership communication, offering new tools for preparation, engagement, and evaluation. Strong leadership and skilled spokespersons are essential for effective crisis communication, building trust, and supporting response strategies. Explore the essentials of internal communication and coordination during emergencies, focusing on building resilient systems for effective response. Strong internal communication is crucial for effective emergency response, preventing confusion and delays. Internal communication involves sharing information to support decision-making, coordinate actions, and improve efficiency. Effective internal communication during emergencies leads to faster response times, improved coordination, and better resource management. Challenges like information overload and staff shortages can hinder communication during emergencies. A clear communication structure ensures efficient information flow from leadership to frontline personnel. The incident command system clarifies roles and improves coordination during emergencies. Leadership communication provides direction, updates, and support during emergencies, enhancing team effectiveness. Situation reports offer timely updates on emergency conditions and actions taken, aiding in decision-making. Staff communication strategies include briefings, notifications, and meetings to ensure everyone is informed. Communication technology, like alert systems and collaboration platforms, enhances emergency response. Timely updates and accurate information sharing are vital for effective emergency coordination. Healthcare workers need clear communication on clinical guidance, safety, and operational updates during emergencies. Cross-department coordination is essential for effective emergency response, requiring seamless collaboration. Communication with external partners, like public health agencies and NGOs, is crucial during emergencies. Managing communication during remote operations involves virtual coordination and digital tools. Managing rumors within organizations is crucial to prevent misinformation during emergencies. Effective emergency communication includes addressing psychological support and stress management for employees. Evaluating communication effectiveness involves assessing feedback, reach, and response times. The future of internal emergency communication includes AI-powered systems and integrated platforms. Key takeaways include the importance of internal communication, structures, and staff communication during emergencies. Explore how effective internal communication and coordination are vital during emergencies. Strong internal communication is the backbone of effective emergency response, ensuring coordination among all involved parties. Internal communication involves sharing information, supporting decision-making, coordinating actions, and improving efficiency. During emergencies, internal communication ensures faster response times, better resource management, and improved public communication. Challenges like information overload and staff shortages can hinder effective communication during emergencies. A clear communication structure is essential for effective emergency management, from leadership to frontline personnel. The incident command system ensures clear roles, efficient information flow, and improved coordination during emergencies. Leadership communication provides direction, updates, and support, ensuring effective emergency response. Situation reports provide timely updates on emergency conditions, actions taken, and resource status. Effective staff communication strategies include briefings, notifications, and digital updates to ensure everyone is informed. Communication technology, like alert systems and collaboration platforms, enhances emergency response efficiency. Timely updates and accurate information sharing are crucial for effective emergency coordination. Healthcare workers need clear guidance, safety information, and operational updates during emergencies. Cross-department coordination is essential for managing health emergencies effectively. Effective communication with external partners, like public health agencies and NGOs, is crucial during emergencies. Managing communication during remote operations involves virtual coordination, remote support, and digital tools. Managing rumors within organizations is crucial to prevent misinformation during emergencies. Employee well-being and communication address the human needs of personnel during emergencies. Evaluating communication effectiveness involves assessing feedback, reach, and response times. The future of internal emergency communication includes AI systems, collaboration platforms, and digital command centers. Effective internal communication is crucial for organizational resilience and emergency response. In this chapter, we delve into the essential processes of monitoring, evaluating, and continuously improving risk communication strategies during emergencies. These processes are crucial for ensuring effective communication and response. Effective communication during health emergencies relies on knowing what works. By measuring and evaluating communication efforts, organizations can identify strengths, address weaknesses, and improve outcomes. Monitoring and evaluation form a continuous cycle that enhances communication strategies. Each phase, planning, implementing, monitoring, and improving, builds on the last, creating a loop of learning and enhancement. Monitoring is vital during emergencies to detect problems early, track information reach, measure engagement, identify misinformation, improve decision-making, and support rapid adjustments. Key objectives of communication monitoring include ensuring message reach, engaging audiences, fostering public understanding, building trust, encouraging behavioral change, and satisfying stakeholders. Communication performance indicators are divided into process and outcome indicators, measuring both the frequency of activities and their impact on audiences. Measuring message reach involves analyzing media coverage, website visits, social media reach, SMS delivery rates, and community outreach coverage. High reach is necessary but not sufficient for success. Audience engagement is measured through social media interactions, community participation, event attendance, website engagement, and public feedback. These metrics provide insights into audience involvement. Assessing public understanding involves surveys, interviews, focus groups, knowledge assessments, and community consultations. These methods help gauge comprehension and identify barriers. Trust and credibility are measured through public trust surveys, sentiment analysis, stakeholder feedback, media perception analysis, and community confidence indicators. Trust is foundational to effective communication. Behavioral outcomes are monitored by tracking vaccination uptake, mask usage, hand hygiene, social distancing, and healthcare seeking. These behaviors indicate the success of communication efforts. Media monitoring and analysis involve tracking news coverage, assessing message accuracy, analyzing media sentiment, evaluating reach, and detecting emerging issues. These activities help refine communication strategies. Social media monitoring includes trend tracking, hashtag monitoring, sentiment analysis, engagement analytics, and misinformation detection. These tools help manage communication on digital platforms. Monitoring misinformation and rumors involves identifying emerging rumors, tracking information sources, measuring spread, assessing impact, and evaluating corrective actions. This process is crucial for maintaining accurate communication. Community feedback systems include public hotlines, feedback surveys, community meetings, digital platforms, and stakeholder consultations. These systems ensure that community voices are heard and inform communication strategies. Evaluation methods combine quantitative and qualitative approaches, including surveys, analytics, interviews, focus groups, and community discussions. This combination provides a comprehensive understanding of communication effectiveness. After-action reviews identify what worked well, challenges faced, improvements needed, lessons learned, and future recommendations. These reviews are essential for continuous improvement in communication practices. Continuous improvement strategies involve updating communication plans, improving training programs, strengthening monitoring systems, enhancing community engagement, and upgrading technology platforms. These strategies ensure ongoing adaptation and effectiveness. Communication dashboards and analytics provide real-time monitoring, performance tracking, sentiment analysis, behavioral insights, and executive reporting. These tools enable rapid, evidence-based adjustments. The future of communication evaluation involves AI-powered analytics, predictive modeling, real-time monitoring, automated sentiment analysis, smart evaluation platforms, and integrated performance intelligence. These technologies offer smarter, more comprehensive assessments. In summary, effective communication evaluation is an ongoing process of learning, adapting, and improving. Key takeaways include understanding M&E fundamentals, performance indicators, reach, engagement, trust, media monitoring, feedback systems, after-action reviews, and future technologies. In this chapter, we delve into how artificial intelligence, digital platforms, and emerging technologies are revolutionizing health emergency communication. Modern health emergencies demand rapid information sharing and real-time monitoring. Technology now plays a crucial role in risk communication before, during, and after emergencies. The landscape of emergency communication has evolved from traditional media to dynamic, AI-powered digital ecosystems, enabling real-time engagement. Technology facilitates faster information sharing, real-time monitoring, community engagement, data-driven decisions, misinformation detection, and improved coordination during health emergencies. Artificial intelligence enables machines to analyze data, recognize patterns, and support decision-making, transforming how health authorities respond to emergencies. Sentiment analysis tools use natural language processing to interpret public emotions and trust levels, providing real-time insights for community reactions. Predictive analytics help communicators address concerns before they become major issues, reducing the spread of misinformation. AI-powered chatbots and virtual assistants are essential tools in emergency communication, providing consistent, multilingual public information support. Mobile technologies are crucial for reaching populations during health emergencies, offering direct, personal communication pathways. Social media analytics platforms provide unprecedented visibility into public conversations, enabling rapid response to emerging narratives. Digital dashboards offer real-time monitoring, data visualization, and performance tracking, supporting decision-making and resource coordination. GIS technology helps communicators target messages effectively, ensuring no community is left without critical health information. Big data technologies enable public health authorities to process massive volumes of information, transforming raw data into actionable intelligence. Automated alert systems are critical in reaching millions with life-saving information, coordinating warnings across multiple channels. Digital engagement platforms enable participatory, transparent, and inclusive communication at scale during emergencies. AI-powered monitoring systems detect misinformation trends, enabling rapid fact-checking and counter-messaging. As emergency communication systems become digital, protecting them from cyber threats becomes crucial to ensure information integrity. Emerging technologies like AR, VR, and IoT are redefining how health authorities engage with communities during crises. Technology adoption must balance equity, ethics, and scalability to ensure digital tools enhance rather than hinder communication efforts. The future of AI and digital technologies points toward intelligent, autonomous, and personalized communication systems, transforming public health responses. Technology, AI, and digital innovations are transforming emergency risk communication, leading to better information sharing, public engagement, and health management. Chapter 14 delves into global case studies and lessons learned from health emergencies, examining what worked, what failed, and how each crisis shapes the future of public health communication and preparedness. Every health emergency offers valuable lessons about communication, leadership, public trust, misinformation management, and community engagement. Analyzing real-world case studies helps organizations identify best practices and avoid communication failures during future crises. Studying past emergencies transforms experience into institutional knowledge, creating a foundation for stronger, faster, and more effective responses. This continuous cycle ensures that every emergency contributes to a more resilient public health system. A structured framework ensures consistent, rigorous evaluation of every health emergency communication response. By asking essential questions, we can assess what happened, how communication was managed, what worked well, and what challenges were encountered. The 2003 SARS outbreak was a global emergency that underscored the importance of transparency, rapid reporting, and international collaboration. Delayed communication can increase uncertainty and public concern, making early, transparent reporting non-negotiable. During the H1N1 influenza pandemic of 2009, frequent public updates, international coordination, and health education campaigns were key to managing the crisis. However, public uncertainty and conflicting information posed significant challenges. The Ebola outbreak in West Africa highlighted the critical role of community engagement, local leadership involvement, and addressing cultural barriers. Trust and accurate information were essential in controlling the outbreak effectively. The West Africa Ebola response reshaped global understanding of community-centered health communication. Listening, respecting cultural practices, engaging community leaders, building trust, and promoting two-way communication were key principles. The Zika response demonstrated that health communicators must clearly communicate uncertainty while providing practical guidance. Acknowledging the limits of current knowledge empowers the public to take protective action. The COVID-19 pandemic was the largest global health communication event in modern history. Rapid information sharing, digital engagement, and global collaboration were crucial, but misinformation and political influences posed significant challenges. Public trust became one of the strongest predictors of compliance with health guidance during COVID-19. Transparency, frequent updates, scientific communication, empathy, and public engagement were essential pillars. The COVID-19 pandemic was accompanied by an unprecedented infodemic, complicating public health response. Addressing misinformation through fact-checking, digital monitoring, and social media challenges was crucial. The MPOX response highlighted challenges such as public awareness gaps, stigma concerns, and rapid information needs. Lessons learned included avoiding stigmatizing language, promoting inclusive communication, and engaging at-risk communities. Natural disasters create complex health communication environments where public safety, health risks, resource information, and recovery guidance are crucial. Effective communication prioritizes immediate life safety information. Healthcare cybersecurity incidents, such as ransomware attacks and data breaches, require specialized communication strategies that balance transparency with security concerns. Effective communication is crucial in managing these incidents. Across every major health emergency, 6 consistent factors distinguished effective communication responses from failed ones: early communication, transparency, community engagement, leadership visibility, consistent messaging, and trusted messengers. Understanding what goes wrong is just as important as knowing what works. Common communication failures include delayed information, lack of transparency, contradictory messages, ignoring community concerns, poor coordination, and inadequate monitoring. The most successful communication programs balance scientific accuracy with empathy and community engagement. 6 principles represent the gold standard of emergency health communication. Be first, be accurate, be credible, express empathy, promote action, and listen to communities. Effective organizations don't just respond to emergencies, they systematically capture, document, and apply lessons learned to strengthen their preparedness capabilities. After action reviews, lessons learned databases, continuous training, scenario exercises, and knowledge sharing programs are key components. The next generation of emergency communication will be shaped by artificial intelligence, digital trust management, and globally connected information networks. These innovations will transform how we prepare for and respond to health crises. Global health emergencies consistently demonstrate that effective communication depends on transparency, trust, empathy, community engagement, timely information sharing, and strong leadership. Organizations that apply these lessons are better prepared to protect public health during future crises. Chapter 15 delves into the future trends in risk communication and professional certification, highlighting how technology, science, leadership, and community engagement are reshaping health emergency communication. As health emergencies grow more complex, communicators must integrate technology, science, and leadership. The future of risk communication will be driven by AI, predictive analytics, and community-centered strategies. From traditional media to AI-powered systems, risk communication has transformed significantly. This evolution reflects not just technological change but a fundamental shift in how we communicate about risk. Modern health emergencies present complex challenges, including climate change impacts, infectious diseases, and digital misinformation. Communicators must navigate this interconnected threat landscape effectively. AI tools are revolutionizing how we communicate risk, enabling faster, smarter, and more targeted emergency communication. From predictive messaging to sentiment analysis, AI is at the forefront of this transformation. Using data analytics, we can anticipate public concerns and shift from reactive to proactive emergency communication. This approach enhances early intervention, preparedness, and resource allocation. Future systems will deliver tailored health messages based on individual needs, ensuring the right message reaches the right person at the right time. This approach enhances audience segmentation and targeted alerts. Social media is now the primary arena for public health communication, offering real-time engagement and interactive platforms. These tools are essential for transparent communication and trust building. Technology is fostering more inclusive participation in public health decision-making. Tools like virtual town halls and digital platforms allow communities to contribute actively to emergency response. AI-powered tools are crucial in combating misinformation, enabling real-time monitoring and automated fact-checking. These technologies help maintain trust and accuracy in health communication. Organizations that leverage data can make faster, smarter decisions during health emergencies. Real-time analytics and predictive intelligence are key to effective communication and resource management. Future health emergencies will require coordinated communication across borders. International collaboration is crucial for effective response and information sharing. Climate change is increasing the frequency of extreme weather events, demanding new communication strategies. Effective communication is vital for addressing these environmental challenges. Emerging technologies like AR, VR, and IoT are set to revolutionize how we communicate during emergencies. These tools offer innovative ways to engage and inform communities. As communication systems become more powerful, ethical governance is essential to maintain public trust. Privacy protection, transparency, and equity are key considerations. Tomorrow's risk communication professionals will need a blend of technical expertise and human-centered leadership. Skills in AI literacy, data analytics, and digital communication are essential. Organizations that invest in resilience and innovation are better prepared for future emergencies. Continuous learning and adaptive communication systems are vital components. The demand for skilled risk communication professionals is rising across sectors. Roles like risk communication specialist and public information officer are crucial in navigating health emergencies. Continuous professional development is crucial for risk communicators to remain effective and relevant. Training, leadership development, and digital skills enhancement are key areas of focus. By 2035, emergency communication will be a fully integrated, community-centered ecosystem. AI, predictive systems, and global collaboration will drive the next decade of public health communication. Explore the future trends in AI, predictive analytics, and digital engagement that are reshaping risk communication. Discover opportunities in AI and predictive communication, personalized messaging, and global collaboration. Learn about the ethical governance and future competencies needed for effective communication. Understand the importance of organizational resilience and career development in expanding opportunities for certified risk communication professionals. Enhance your expertise across the full spectrum of modern emergency communication practice. Dive into areas like risk communication strategy, crisis and emergency communication, and public health communication. Engage with community engagement, media relations, and misinformation management. Develop skills in digital communication technologies and emergency preparedness to become a certified risk communication professional. Discover why CDG training is the right choice for you. Benefit from an industry-relevant curriculum designed for real-world emergency communication challenges. Focus on public health emergencies with practical communication frameworks and global best practices. Enjoy flexible online learning and professional career advancement recognized by employers across the global public health sector. Experience 100% online learning with self-paced options, practical case studies, online examinations, global accessibility, and a digital certificate upon successful completion. Thank you for choosing CDG training. We empower professionals to build trust, communicate effectively, and protect communities during health emergencies. Harness AI-powered intelligence for smarter communication and engage in global collaboration across borders. Focus on community-centered strategies and ethical governance to ensure responsible communication practices. The future of public health depends on communicators who are informed, inspired, equipped, and certified. Your journey starts here.